Hi, everybody.
Morning.
Sorry, it took us a few minutes to get live on Facebook. We're doing this week's coronavirus task force meeting publicly. And I'd also like to point out that we had a few Hammond families that are deaf and have difficulty understanding us. So we have an interpreter so that any families in our city or around Northwest Indiana that wants to hear what's going on in regards to the coronavirus task force to facilitate that. So I want to thank her for participating with that. This is Hammond's coronavirus task force. We've been meeting now since right before the government shutdown, and we've been meeting twice weekly ever since that time. We start off every meeting with a report from Dr. Frank Masana of Comprehensive Care. Then usually after that, we go to Karen Callahan. I don't see her on right now. Oh, she is. I do see her. And then she'll give us a update from St. Margaret Mercy, Franciscan Health in Hammond. And then I'm going to get an update from the Hammond Police Department, the Hammond Fire Department, Hammond Department of Public Works, and anybody else that needs to add to the meeting. This usually will take us right around an hour. So right now we have 135 residents of Northwest Indiana watching this. I imagine during this this call, we should probably get quite a few people watching. So try to talk slowly and clearly so that the interpreter can keep up with us. And let's go ahead and start off the meeting with Dr. Frank Masana from Comprehensive Care. Nice to see you, Dr. Frank.
Good morning. Nice to see you as well, Mayor. So, we're kind of in a status quo pattern as we're waiting for some new things to free up. And what I mean by that is testing is ramping up. We are getting more widespread testing available. It is still being restricted by the Department of Health for high risk, symptomatic individuals. You can't just go in and get a test at this point. As we transition towards the antibody testing, which I think is going to give us greater information as far as what we're looking to be able to do in opening up the economy, know who's been exposed, who hasn't been exposed, as well as get a better handle on how widespread this infection really is in our communities. And we already know that it is a lot more widespread than we originally had thought. There are challenges to that antibody testing. I've been doing research on it. It's very new. LabCorp issued some guidance. They are opening it up as of today for healthcare workers and first line responders only. And as of now, they're only doing it at their service centers. They anticipate increasing the availability of that. I've got a call into them actually this morning to find out if they have any timeline as to when this might be available to be just a blood test to, for clinics and community health centers to be able to start doing the testing and sending it to LabCorp via their normal courier. So hopefully we'll find more information about that. I think that's going to be critical. I do caution a little bit on the antibody testing. The more I read about it, is a qualitative test, not a quantitative test. And real briefly, the difference between that is the qualitative test is simply determining if the antibody is in your system, not the level of antibodies. So when we typically draw a titer, such as someone comes in to get a hepatitis titer or measles titer, we're looking at the number of antibodies, which is a qualitative test, and that is what we use to determine immunity. In this case, we really don't know if this is going to be that they're immune or they just simply mounted an antibody response. We suspect, and I think there's a good likelihood and a very high likelihood that there's going to be some immunity, at least for some period of time. We'll know more as we go down the road. So I'm encouraged to see that the companies coming out with these tests. They had to develop these from scratch, and they did it in very fast, but it's never fast enough as we're trying to get to the next level and try to get, people out there. I do encourage people to remember that, the whole reason we did this was to level or flatten the curve, as the saying goes, so that we didn't overwhelm the healthcare system all at once with very high intensity need patients. And we accomplished that. We absolutely accomplished that. We're not going to keep people indoors or, isolated until this virus goes away. It's just not possible. So as things do loosen up, I expect that we're going to see more cases, and there will be more deaths, unfortunately. And that's just, an unfortunate reality. So I just want people to keep that in mind. We can't stay indoors until this is gone. It just isn't going to happen. We just have to use caution. And when I was out for a run yesterday, and it was very interesting. Everybody was really doing social distancing while you're running, because as I'm running down the sidewalk, if somebody was coming, I would cross the street or they would cross the street. We would get out of each other's way so that we stayed well apart from each other. So people in society, I think, are understanding of this and are taking it serious, and that's what it's going to take. And I think people got the message. So we'll see what happens going forward.
So, Dr. Frank, now we've learned over the weeks, I know some people are watching for the first time, that primarily there's two types of testing going on. Yeah,
Yep.
The swab testing, which is
Yep.
where they put the swab in the nose and they analyze it, right? And
Yep.
the turnaround time on the swab testing is
Totally
unfortunately
variable.
What's that?
It's totally variable. The Abbott test is literally 5 minutes, maybe 15 minutes if it's a negative. But if they're sending it to the lab, it's typically 24 to 72 hours.
24 to 72 for first responders, right?
Yeah, I mean, they've gotten better depending on where you're at in the country because of the volume of tests that are coming in. So out east, I've heard that it's still taking up to a week to get results back. Other areas where you're not submitting such large volume of tests, they're getting through them quicker. I think that the amount of labs that are able to do it is also increased. So that number is coming down, but they're still going to have some cases that go on beyond that.
That's the thing about the antibody test that's so much more appealing is the quick turnaround, right? It's literally 10, 15 minutes.
Well, there's different types of antibody tests that are out there, and I again urge a little caution. We really have to do our due diligence before recommending any of these tests. And the reason I say that is the FDA has not tested these tests or certified them. They've put them through at a very fast pace, and they're relying on companies to self-certify the tests. Some of them are going to do a very good job of that, and some of them are not. So I personally am looking at the larger labs, the well-established labs who have the infrastructure to do that testing and certify that the results. They're not going to be perfect. There's going to be false negatives and false positives on these. So the test you're talking about is where you poke your thumb, you get a little droplet of blood, and it shows up on a card. That is available, but not nearly. It's going to take a while before that's widely out there. There's just not enough of those kits. The first thing you're going to see is the blood serum testing, where you just draw a tube of blood and you send it to the lab, and you can get results in 24 to 72 hours on those as well. So it's still going to be a little bit of a time delay in getting those results.
So those will have to be done by healthcare professionals too, versus if you prick your skin, and, that could be done in your own home. Whereas if you're drawing blood and sending it to a lab, that's going to have to be done at the hospitals or CompCare or the mobile testing sites.
That's correct. And right now, LabCorp, which is, I think, the nation's largest laboratory, is only doing them at their centers. So they have, 2,000 centers across the country where people can go in and have tests done that are ordered, still need a prescription for it. So they're not offering it out there widely yet. I don't think they have the capacity to be able to do it. But you are correct. Eventually, I believe we will have this to the point where people can do it, even the blood test at home, and get a determination on that.
So right now in Indiana, We have 81,708 Hoosiers tested as of yesterday, which is 1.4% of the population. What is, there's questions about Governor Holcomb's intentions on whether or not he plans to open the state of Indiana in 1 week. His order expires on Friday at midnight, I believe. Now, the question of the day is, are we going to have to open City Hall in 1 week? And what is your opinion as a doctor? Would you, if you were a governor right now, and I know you're not, and you love politics, I'm being sarcastic when I say that. If you were the governor right now, what would your call be as far as Friday nights? I know Governor Pritzker in Illinois extended through the month of May. The question on the table in Indiana is, what is Governor Holcomb going to do about his order that expires on Friday? What do you think?
Sure. I'll give you my opinion, as a physician. Obviously, the personal opinions are what they are. I think that each state in each area is going to have different challenges to reopening. State of Indiana in general has not seen this as significant of an outbreak as other areas such as Chicago, but if you look, or Illinois, but if you look at Chicago, oh God, I mean, on a percentage basis, I gotta say at least 75% of the cases are in Chicago and the surrounding, collar counties. So I personally would caution a one-size-fits-all approach because there's no reason that certain areas can't start getting back to doing things in a responsible manner. Again, I always look back to the intention was to flatten this curve so that we don't overwhelm the healthcare system, and we've done that. And I think if you put responsible actions in place and you put guidance in place, I think majority of businesses and people will follow those because they really want to get out and they want to get back to work. So it's a challenge for each municipality. The governor of Georgia, as we all know, really opened things up a lot faster. It'll be curious to see, how that works out and what we can learn from that. If it works well, I suspect, and there's no increases or no significant increases, you're going to see other states following suit pretty quickly. If it doesn't, you're going to see them hunkering down a little longer.
Okay. Questions coming from the internet about mosquito season coming up. And have you heard anything about COVID-19 being spread by mosquitoes? Is that something for us to worry about with summertime approaching?
No, this is a respiratory spread virus. It's not a bloodborne virus. So unless something really, really strange happens and it mutates dramatically, there's really no risk of that occurring.
Great, thanks. Okay, let's go to Karen Callahan. Thanks, Doc. Stay on the line, obviously. We'll probably come back to you again, Doctor.
Sure.
Karen Callahan always gives us an update from Franciscan Healthcare Hammond. Hi, Karen, how you doing?
Hi, Mayor Tom. Hi, City of Hammond.
We have a lot of people watching online also, and what is your exact position at St. Margaret's? I know you're like the head of nursing or one of the heads of nursing.
Oh, no, please. I'm the emergency department nurse manager. So okay. For Franciscan, we have about 92% of the admissions of the hospital come through the ED. So that's why I'm kind of part of some of the COVID task force for you as well as the hospital, because we see a great number of the admissions come through us. What I wanted
last time we talked, I wrote down numbers were trending down. This is last Thursday. Numbers were trending down. Elective surgeries were beginning on Monday, and all staff inside the hospital to and from wear masks basically at all times. That was basically your report from the last time we spoke. Is this?
Yep, that's still correct. That all happened. We currently have 27 positive in-house, 7 rule outs, which for the public, a rule out is we don't have a negative or positive yet, but they were tested. The other thing that I have not said that I wanted to add to the public is that year to date, since this kind of started, we want to say about the second week of March, we've had 68 patients from the emergency department discharged, and then inpatient 62. So I want people to know that people do live from this, and there is positive at the end. Can you hear me? Oh, yeah, okay, sorry. So there is positive at the end of the, there's a light at the end of the tunnel, but with that being said, I just wanted to piggyback on Dr. Frank's about the serology or the antibody testing. What my fear is that people will get tested, it won't be FDA approved, and it'll give them a false reassurance that they don't have to wash their hands anymore, that they don't have to cover their mouth when they cough, they don't have to drink their water or stay, you know, try to build up that immune system. All those things are still in place, and unfortunately, masking in the public and washing hands and, you know, being cognizant of door handles and things like that, we still have to use that because that's best practice right now, and that's going to be kind of moving forward some of our new normals. So I just wanted to say that about that. And then my last thing is I also, we have a fluid playbook. So every day, you know, we're learning new things about COVID-19, and it's just in the hospital, it's just online, it's on our intranet page, and we just keep adding to it what we learn, what has worked well and what has not. So all of staff can easily see the changes because there's a lot, as you have already noticed. So that's all. I just wanted to mention those things.
Okay. So right now in the hospital, how are we doing with the vacancy rate? I mean, are you guys jam-packed? Do you guys have open beds?
No, we have open beds. Our capacity, like I've said before, is about 150 on normal days, but right now we had a very low census weekend, probably because it was nice out and people are still being smart, social distancing, where our volume this morning was 87. So we are fine.
So you're like what, 60% capacity?
Yes, you're better at math than I am. Yes.
So in your opinion, I mean, I know, you know, you work with a lot of, you know, infectious disease experts and doctors, and, you know, you're surrounded by, you know, super smart people, as well as being super smart yourself. Do you think that we've flattened the curve, and have we been successful with the shelter in place?
I think we have done a phenomenal, the state of Indiana, I think, has done a phenomenal job at flattening the curve. Yes. And again, that's some of my hesitancy about opening, is because we just want to make sure that we maintain this a little bit longer. Over the weekend, what they were seeing more were true emergencies, like the good old days pre-COVID was actual emergency situations, non-COVID. So that, I mean, that's never a good thing, but it's good in the sense that they were not COVID patients. So
Karen, I'm going to give you the same question that I gave to Dr. Frank earlier. If you were in charge of the state of Indiana right now, knowing what's going on in Illinois, knowing what's going on with flattening the curve, and knowing that Governor Holcomb's order expires on Friday, what would be your recommendation to the governor?
So my personal opinion is that we need a little more time. And again, that's a personal opinion. I think that we've done such a good job. I think that since the hospital especially lies right on state line, I think it would be smart for, you know, at least Lake County to emulate what Illinois is doing. I do think I understand that we need to get the economy going. And I completely understand that I have 3 kids out of work, but I also feel like safety to me right now is number one. And I think a staggering effect of surgeries, 25% are coming in to the Munster campus today. On Monday, the following week, then they'll start at Dyer and we'll increase the percentage at Munster as long as our cases still remain either plateaued or on a downward trend. So that was a long answer to your question, but.
So basically the gist of your answer is you think we need a little bit more time. We should be more like Illinois, and you've succeeded. You think we've succeeded in Indiana in flattening the curve? And I appreciate that, Karen.
Yes, yep, thank you. You're welcome.
Thank you. I just got handed something by my deputy fire chief that points out in the city of Hammond, we have had no new positive COVID-19 patients transported since April 27th, which was what, 3 days ago? No.
That's today, since the 21st.
Since the 21st, I apologize. Since the 21st, so 6 days. That's just encouraging. So, all right, Dr. Frank, do you got anything you want to hit again before I go to the police and fire for updates?
No, go right ahead. Thank you.
Okay, Kevin Margraf, do you want to? You guys aren't going to be able to see Kevin. He's in here in this meeting. So, Kevin, why don't you give an update from the Hammond Fire Department?
First of all, Mayor, I would like to tell you is from a supply standpoint, we probably are good for every bit of a month.
In PPE, in regards to PPE?
Yes, we
For
are.
a month, that's great.
Yes, we are. Actually, BPMICO reached out to us and we were able to get 1,000 more N95 masks if need be, on top of the 500 or so that we have in stock now. We're still, the one positive case for Hammond should be back to work on Wednesday.
So you have one fireman?
We have two that still are not at work. One will be back through the 14-day, 72-hour, no symptom quarantine.
Mhm.
And the other individual is still kind of out there awaiting his spouse's return to work. We're kind of unsure as to how to move forward with that.
Kevin, in the fire department, you've had a few people that have had to be tested, a few firefighters that had to be tested.
We probably have 8 that have turned up to be negative.
And how long did it take you initially when we first got into lockdown? Is it getting quicker for you to get the results back? Because I remember we had one firefighter, we waited over 8 days for
That
the
was
results back.
the very first individual. And I think a lot of this was all new to everybody that was involved in that. But since then, it's probably been, like Dr. Frank and Karen have mentioned, between 24 and 72 hours.
So it's a lot better.
It is a lot better, yes.
So we've gotten better as the crisis.
Yes,
Right
we
now,
have.
we're taking our first responders to either St. Margaret's and Hammond or community hospital still.
We go strictly to St. Margaret's.
Good.
Strictly to St.
Hammond, right?
Margaret's.
There you go, Karen.
But beyond that, I mean, our guys are really doing,
Okay, thank you.
they're really doing a great job. I mean, you see the transport list. We haven't had any in 6 days. That doesn't mean positive cases may not be winding up at the hospital, but they're going there some other means, not by us.
Mm-hmm. Hey, there's a protocol you guys are doing. I think Chief Smith called it doorstep protocol. You know what I'm talking about?
I do.
Good.
I do.
Because I'm
guessing.
So basically, let's say I got into a bike accident and I hurt my leg real bad, right? And I got back home and I was bleeding and my wife called for a paramedic to pick me up. How is that going to go down? Could you explain something like that where I have a bad injury, but...
Well, I'm guessing with what's going on now, the doorstep thing is if the individual is able to be communicated from outside, maybe on their porch, or maybe just subsequently a little bit into the home, and we're able to convince them, due to whatever the nature of their injury might be better off with everything that's going on to get themselves to the hospital, to the emergency room. Some individuals have been doing so. So meaning if we don't have to transport, we don't, because they're understanding of what's going on to take themselves.
Okay.
And that has happened.
So like basically a lot of stuff that you normally maybe in January or February this year, you would have picked me up and taken me to the hospital for. Now it's being resolved on the doorstep so that the person doesn't have
Some of it is, that is very true, yes.
So are your cases down as far as your transports?
I would say they probably are.
Okay.
I don't have a specific number. I mean, we crunched numbers a couple of weeks ago. They were down, maybe with the casino being shut down, that probably was 12 runs a month.
Yeah.
We don't have those.
Right.
So the numbers are down in that regard.
Now, another thing, and obviously I know the answers to these, and I realize there's 280 people watching live right now, and most of us have heard this before, but can you describe for me the difference in an ambulance now as opposed to January 2020? What's different?
Well, what's different now is when we would get a call through dispatch for a sick person, Generally, they're following that up with use universal precautions. And what that means is the guys on the ambulance will put a Tyvek suit on, they will put gloves on, they will put a mask on, they may put goggles on. So we may be walking into someone's home looking like a Martian.
Mhm.
Something that a lot of people have not seen in a while, but to protect us and to protect them, this is the day and age, at least right now, how our ambulance crews are dealing with the public.
Okay, thank you.
You're welcome.
We're gonna go, Andy Short, who's the Assistant Chief of Police. Could you turn it this way? So, Andy, could you give us an update on PPE levels that you have in the PD, and then give us an update on any positive tests you have in the PD, and then just some other just general.
Well, basically, as far as the PPE, we have just received a large supply of 1,000 masks on Friday, so we should be taken care of for the next several weeks. Everything.
So you have several weeks of PPE on?
Yes, yes,
Right.
yes. We're doing very well in regards to that. And we're getting like all kinds of different donations from different organizations around here in the city, which is nice, especially First Baptist and a couple other people. They're doing some pretty good service. As far as the as far as the men on the streets, we only had like 5. We have 5 cases. Only 1 tested positive, and as of today, all of our men are fully staffed.
You said you had 5 tested? I'm sorry.
Yeah, we had no, we had 5 who had symptoms who had initially called off. 1 was tested, and he tested positive. We all know who he is.
Yeah.
But as
Okay.
of today, everybody else is back to work.
What about crime? You know, a lot of people ask me all the time, are we still have the same number of officers on the street, same beats? Are we like not covering at nighttime?
Oh,
Is there-
no. We, as a matter of fact, some of our special units have started to help out. We have our narcotics units. They're in a B car, and they're working from 8 p.m. to 12. We have our special, the gang units. They're working the afternoon shift all the way to the midnight shift. And we also have community affairs. They're working, covering the day shift. So we got everybody out there on the streets.
Okay. Thanks, Andy.
Mhm.
I'm going to go. I want Catherine, who's on from the school city, Hammond, be on alert. I'm going to come to you next. Okay. But I'm going to go to Gary Gleason next. I think Gary's on there someplace. Gary, you out there?
Yes, I am, Mayor.
Hi. How's it going, Gary?
We're doing real good. I give you an up-to-date. Good morning, everybody. We're happy to say that right
Gary's
now,
from-
everybody.
Hold on, Gary. Gary's from Hammond Public Works, everybody. He's going to explain what's going on in the Public Works Department. So go ahead, Gary.
Okay, we're happy to say with 120 employees right now, everybody's back. We don't have anybody off at this time. With our PPE protective equipment, we're doing good. We have glove, masks, and if we do run short, the other departments are all working well together. Actually, today in our earlier meeting, fire department, have you heard from Kevin Margraf that they were able to locate some masks? So I'm a little bit down waiting on my order. So they jumped in to help me. What we did with our office is we put up the plexiglass in between the desks for the secretaries. We've moved some of the secretaries around a little bit. The Teamsters asked us just to help them out with, when there is a 2-man truck, try to keep it 2-man without rotating them and stuff like that to try to keep it down. We have a person that goes through the complex all day long, wiping off door handles and anything, computers or printers or anything that would be touched periodically through the day. So right now we're moving along real good. There was one thing that was brought to my attention is mattresses that being open and exposed, that we prefer that the resident wraps them in any type of plastic, blue tarp from any hardware store's fine. It's just a lot healthier to do that. So we're notifying them if we see it. We made a flyer, we put it in the box, and as soon as it's wrapped, we try to make it a priority to pick it up for them helping us out.
Okay. So right now, all garbage pickups on time, all recycling pickups on time, right?
Yes.
And garbage has to be contained in the cans. We're doing special item pickup if they call it in, right?
Yes, we are, Mayor. If it's like, furniture or end table or something like that, we send that truck. They're still using the 311 app that is really moving along quite well with us. So the sanitation pickup, if we can, we'll put an extra guy on the heavy day or something like that, but everybody's moving along. The morale is good. Of course, I'm really proud of the department, and men and women there work great for us.
Okay. And then, everybody's trying to clean out their basements and their garage. And then, of course, they put all of it out for you guys to pick up. So what do you do when you come upon a house that has 2 garbage bins that are completely full, and then there's just overflowing garbage that they expect you to pick up? How are we handling that situation?
I'll be honest, Mayor, we don't have the time to stand and pick up stuff. I know if everything is contained in the green can, it's going to make it a lot quicker, a lot cleaner, and a lot easier. The trucks actually flip the can for us. If something happens to be behind your house, you just got to take that little extra step, help us out, pick it up, put it in the can. It'll make things a lot better for everybody. Plus, keep your area and your own home clean.
Okay. Thank you, Gary. Appreciate it.
Thank you.
Hammond Public Works. Johnny, you have anything to add? I'm sorry. I forget you're right, sitting there right next to me. Catherine Danko from the School City of Hammond. How you doing, Catherine? You're muted.
There we go. Hi,
Okay.
we're doing well, thank you.
Oh, sorry. Could you give us an update? A lot of people, I know you've updated us 2 or 3 times on what's going on with the School City. Can you go ahead and, basically give us an update, acting like we don't know anything what's going on in the School City right now for all the people that are watching this for their first time?
Sure. I think the most public thing that we're doing that people see are the free breakfast and lunch program at the 6 locations. If you need to know the locations, you can go to our website. We are passing out breakfasts and lunches on Mondays, Wednesdays, and Fridays. There is a calendar on the website as well. If you have School City of Hammond students, you can fill out a form ahead of time. And if you have the form just in your window, your children do not need to be in the car with you. If you are from outside of the School City of Hammond, your children need to be in the car with you. So that is a change from the beginning of the program. And the district is working with the federal government to keep the program going into the summer, just like we always do, without any breaks. We've given out thousands of Chromebooks at our Chromebook distribution sites. Now, if a family needs a Chromebook, please let your child's teacher know or let your child's principal know, and they will work with you individually to get a Chromebook. I think we're out of hotspots now for Wi-Fi, but we're looking to purchase some more hotspots, especially if this continues going on.
Catherine, I've had a couple teachers reach out to me and ask if I would put it out to the public that, there is a lot of students being responsible and doing their homework right now with the homeschooling, but there's also quite a few that aren't responding at all. And
right,
if they're School City Hammond students or just about any school anymore, they're supposed to be doing homework and having Zoom classroom meetings right now, correct?
They are, and we are aware of that, and we're on top of it. Teachers are reaching out to students and families who haven't been responding, and people don't respond for different reasons. Sometimes there's a lot going on in the home. It's not that they're not wanting to do their work. It's just there are some other issues happening right now. So teachers, if they don't get a response, every school has a team set up to reach out to families, principals, assistant principals, deans, counselors, family involvement, facilitators. They're all working together to reach the families. If anyone out there hears of any family who needs extra help, they can contact anyone in the school district, and we'll reach out to that family as well.
Thank you. Another question I got off the internet was for the graduating seniors this year, and I guess to a certain extent 8th graders, but seniors mostly. Is there anything the School City's doing to try to recognize the graduating classes? One question in particular was, can they loan out cap and gowns so the kids could take pictures with their cap and gown on things of that nature. Is there any thought going into that?
Yes, there's a committee that's working on all of the senior stuff, and there are students and parents on that committee as well, because it'll be done across the 4 high schools, not just instead of having separate plans from every school, but they do involve cap and gown pickups so that students do have access to that to take their pictures and everything like that. So graduation's being planned. It won't look the same as a typical year-end graduation. All of that is under consideration.
Catherine, could you, and Scott, I think Superintendent Miller is doing a great job. Can you pass along information to him to let him know that if you guys need the pavilion for anything like that, because the pavilion could fit 15,000 people.
Okay.
So if you needed to do some type of ceremony and spread people out over a large period, over a large area, you have total access to the pavilion for ceremonies. If I'm just throwing it out there. If Superintendent Miller needs a big space, the pavilion is available for these types of ceremonies, if it's even practical.
Okay, thank you so much.
Okay. Is there anything else you'd like to add from the school city's perspective?
No, just that, like you said, the teachers are doing an amazing job. Everyone's working well, and the families are responding very well. We've had it has actually been very positive with our families and our students. They're doing a great job.
Thank you very much. Okay. Before I jump, I'm going to go to the parks next, but I want to talk to Karen Callahan real quick. Karen Callahan, you wanted to give us an update on EMS arrivals?
Yeah, sorry, I just got this email and I thought it was quite interesting when we talk about the flattening the curve and how well Illinois or Indiana's doing compared to Illinois. So at all 3 Franciscan facilities, Dyer, Hammond, and Munster, Hammond in particular, percentage of positive COVID patients brought in by Illinois EMS is 83.3%. So 70 patients were brought in by Illinois as opposed to 14 by Indiana. So does that mean that Indiana as a state, as a whole, Lake County are doing much better at social distancing and all the things that we're kind of talking them, to do, hand washing, blah, blah, blah? I think so. And then Dyer had 88% of their positive COVIDs to the Dyer hospital. 88% came in by Illinois EMS. I thought that was pretty interesting.
Okay, I appreciate that. Thanks, Karen. Dr. Frank, I want you to hang on too. I'm going to come back to you guys. I want Karen and Dr. Frank to think about this one so I come back. What's the world going to look like when we all go back to work? I want you guys to think about that, okay? So we'll sort of end with that one. I'm going to go to Mark Hines from the Hammond Parks Department. How you doing, Mark?
Doing okay. How are you?
Okay, I can hear you. Yeah, why don't you give me an update? Should be an easy one from the Hammond Parks. And then I want you to think about what the world looks like after coronavirus. Like, are we going to have basketball leagues, volleyball leagues at the Sportsplex this summer? We had this conversation this morning in our staff meeting. I thought it was a good one. So I wanted you to sort of recreate the conversation we had this morning at staff. So just give us an update where we are now, where you think we're going to be over the summer, if you don't mind.
Sure. We're currently treated, you almost think that all parks are closed, with the exception of you can go walk your dog, ride a bike, the greenways. Dr. Franker mentioned it earlier. We went for a run on the weekend, I think it was, and yeah, you see someone coming, guess what? You cut across the street. Go down to another block and go to the next street to avoid that. So same way within the parks and all of our park pathways and so forth. So that's the kind of simplest way to look at it right now is what we're doing. We are allowing fishing currently out at Dowling Parks Pond, again with social distancing, also at Wolf Lake with the Port Authority up there. But we're getting ready. We currently, of course, the Sportsplex is currently closed, as is the Gene Shepherd Center, as is the Civic Center, and our staff is currently all working from home. So we are trying to come up with a plan to follow the federal guidelines for the Opening Up America guidelines that were put out. and we're also been speaking to a number of other parks and rec agencies across the state. We do see this happening in a multiple phase, kind of thinking of it as a slow or soft opening, and to continue where the social distancing is still being enforced and making sure that people aren't coming into contact with each other. So we do anticipate, now again, this is not yet, but the plan, I believe, will be is opening up things like that are individual recreational sports. So this might be like our disc golf courses, which are currently closed in 2 of our parks. The golf course at the Port Authority at Lost Marsh, where, with certain guidelines in place when the governor lifts the stay home order. We also expect tennis courts. We don't have many, but those, because that's mainly an individual sport game or 1 against 1 and plenty distance far apart enough from each other. So I do think that in that first phase, at least, actually, according to the guidelines from the federal government, the organized athletic activities will still be closed. Group facilities in our parks, like playgrounds, like basketball courts, those will continue to be closed. Skate parks, the social distancing, and it's interesting because what we do in the parks is so socially involved. The social distancing, or what the National Recreation Park Association has been calling physical distancing, is the important thing to remember, besides the continual washing of hands and the different other things that have been advised here during this time.
Okay. So basically right now, the only thing we can do in parks is solo activities, riding your bike, jogging, walking.
Right.
That's about it.
That's about it.
So Sportsplex, once we're allowed to open up again, will it probably be open for walking then upstairs?
I anticipate that that'll be the first thing when the Sportsplex reopens. That would be the first thing that will open. We may have certain restrictions, just like they are in a lot of the stores that you go to. We may have to, depending on how popular it is, limit the amount of people. So we're getting prepared and coming up with a plan that we can, make sure that we have a safe participation from those who do decide to come in there when that time comes to be able to open it. The soccer fields, the basketball, volleyball courts will be a lot more difficult to open because of the nature of the activities of those particular activities. And then rooms that we have at the Gene Shepherd, the Sportsplex, the rental rooms that people have parties. Most of those are between, well over 50 people, 100 people. So we'll have to follow the guidelines as they stair step, opening more and more things up, having more people in a closer area where we can have those all opened up again.
Okay. So to summarize what the world's going to look like when we're allowed to start recreating again, you imagine the Sportsplex probably opens up to walking first, but it'll be a while before you see soccer tournaments and games and basketball and volleyball tournaments and games. That's probably not going to come back for the near future.
I do anticipate that. And you know me, Mayor, I'm that park and rec nerd. I'm always looking for stuff along those lines. I read something this weekend about Major League Baseball, for instance, possibly mandating their umpires stand 8 feet behind the catcher and calling balls and strikes. Can you imagine seeing something like that? But I mean, there's things that this is obviously going to change us in a long time. Across the state, there was another a community that is mandating when they do open up baseball, they're going to mandate their kids get those breathable kind of scarves that they can stretch out over their face when they do play. And they're going to mandate that as part of their uniforms in their leagues, which is an interesting, again, another change until we know for sure where things are going and when it's completely, I guess, safe again to go back to what we perceived previously as normal.
Okay. Thank you. I appreciate it.
Sure.
Next, I'm going to go to Hammond Baptist Church, Rick Sparks. I see on here. Rick's presented a couple times to our panel about the homeless facility, the homeless shelter run by the Baptist Church in downtown Hammond. We had a lot of conversation early on about the group homes in our city, something the long-term care homes and the homeless shelters in our city. And we've been working real close with them. Rick has been on almost every call we've had. How you doing, Rick?
Doing well, Mayor. Thank you.
Good. Can you go ahead and sort of reiterate stuff that we know, but there's a lot of people watching right now that aren't aware that of all the steps you're taking to make sure that you have a healthy population?
Certainly. We immediately, about the second week of March is when we shut off anyone going into the mission other than the mission men themselves. We have provided masks for all the men living in the mission. They are required in the mission to wear them. With the public building shut down in the city, the men are basically staying on the property. So that's been healthy for them. The men are also, we've spread them out in 2 other buildings that we own in order to spread them and give them more space. We have a facility set up for quarantine if we need to do that, but as of today, we've still not needed to do that. The men have been healthy. Regional, which is right down the street, the clinic has checked on them daily, and we also check them every night for temperatures before before we begin the evenings. And so far, we've had healthy people, so things are going well.
Thank you very much, Rick. We appreciate it. Okay, next I want to go to my Chief of Staff, Phil Talon, who's going to give an update on City Hall and government buildings. Hi, Phil. How you doing?
Hey, Mayor. Thank you. Doing great. Thanks, everybody. Just wanted to give you an update on if and when the Governor Holcomb does take away the shelter-in-place order. We are now preparing for new procedures as residents and other folks come to our municipal buildings. To give you an idea, when City Hall opens back up, and we're going to have people coming in, getting dog tags and business licenses and that sort of thing, we're going to have new procedures in place. We will probably be taking people's temperatures. They're walking through the door. We'll be continuing the social distancing that has been occurring for a while now. We're going to do everything we can to separate our employees so that they are not within the 6 feet of each other, keeping them safe as well. And we're going to be looking at this across all the municipal buildings in the city as what we can do to have the new normal, basically, new procedures to keep everybody safe as the city starts operating normally again and people start coming to the buildings like they typically do when they have needs. So just want to give everybody an update, let them know that we are putting procedures in place so that when we do open up, we will make sure we're keeping our employees and you as safe as possible.
I like how my picture is right over your shoulder like that. It's, always watching you. Always watching over you.
I'm used to that, Mayor.
I have a lot of members of the Hammond City Council on right now. I'd like, if Councilman Warpole is not on, who's the council president, are you on, Dave? Because if he's not, I'm going to go to Councilman Rakos. Give Dave a second, try to answer first. Okay, Councilman Scott Rakos, Vice President of Hammond City Council. Can you give an update from the Hammond City Council, if you don't mind?
Sure. Can you hear me okay? It's the
Yes,
first
sir.
time I talked to you. We're basically haven't skipped a beat. Our last meeting in March, we had like 4 people present and 5 others were on Zoom. This last meeting 2 weeks ago, all 9 of us were on Zoom. We were able to conduct business, and tonight we have our next meeting. We'll be conducting business as normal at our meeting, and all using the Zoom, and we'll be on gohammond.com as well.
That's great. I know that the governor for the COVID-19 epidemic made it legal for us to hold public meetings without the public, which before COVID-19 violated the open door law. Now we have no choice. So we do these meetings with no public input. I know you guys have been sensitive not to do anything controversial during the pandemic because of the fact that public can't give us their normal public input, correct?
That's correct. Last meeting, we normally would have passed an ordinance regarding the casino funds for each district from last year coming over to this year, but we decided to give the public 10 days after the meeting to electronically express their opinion on that before we voted on it.
I think that's great. Personally, I mean, I think that's, as a lawyer speaking, I think that is definitely taking all the considerations of the public into consideration. Since they can't be there, if we have a quote unquote public hearing over Zoom, you know, it was recommended by one of your fellow councilmen to wait one more meeting to pass it. I think that was an excellent idea, and I'm really glad you guys did that.
Yeah, I agree. I agree.
Okay. And so anything else you want to add on behalf of the Hammond City Council?
Now, the meeting tonight will be tonight at 6 o'clock, and we'll be on gohammond.com, and we'll be on Zoom.
Okay. Thank you very much, Councilman Rakos, Vice President of Hammond City Council. I'm going to go back to Karen Callahan, and I'm going to finish up with Dr. Frank. Karen, you there?
Yes, sir, I am.
Hi, Karen. I'm going to ask you, eventually we're going to come out of this, and eventually we're going to go back to work, and we're going to have to open City Hall, and all my non-essential employees are going to come back to work, and then we're going to open up our buildings for the public. What's the world going to look like, in your opinion, when we do that?
So in my opinion, I think when we talk about back to normal, I think our new normal is going to be not our back to normal. I think we're going to see a lot of people initially afraid. I think a lot of people are, I think masks is going to be part of our clothing. You're going to see stores that are mask stores that are going to be producing masks. I think we're going to see that for a long period of time. I also do know that hand washing and all those things that we talked about, I think people 100% understand the really reason why healthcare workers have pushed that for years. But I think that's going to be, to me, that's the best thing out of this, is that people are really going to understand, handshakes may be out the window. We may see, elbow bumps or, fist bumps. I think those are the things that we're going to see. I think our whole mindset is going to be different. I think everybody is going to be creative. Like the teachers, look at how they turned their schools around in literally a day or a week. We talk about healthcare workers as superheroes. I really believe that the teachers should get some of that credit because they've kept the schools going because they had to. So that's just my personal opinion. I hope that related to healthcare, that the nation has an after action meeting, that it's so large, because healthcare has to change, because I think we've identified that we were really not as well prepared for something like this as we wish we would have been. But I think our new normal is going to be different than our old normal.
Okay.
And that's my thoughts.
Thank you, Karen. Dr.
Sure.
Frank, same question, Dr. Frank. How's the world going to
Sure.
look when we go back to work?
Clearly different in different ways. I think that, nationally, we're going to look at our supply chain and try to bring things back to this country. We identified that we're a little too dependent on countries that may not necessarily have our best interest in mind for certain critical things. I think that Karen's absolutely correct. You're going to see people wearing masks. It's going to be kind of a more normal thing to see. I'll be curious to see how long they let you wear them into the banks, but you're going to see that. And I think that's not a bad thing. Some of the social distancing measures will make a difference during cold and flu season. So if we carry some of those things going forward, it's going to make a difference. I think Mark made a good point when he talked about, different, leagues looking at different measures to get things going, whether it be facial coverings or the umpires sitting back. What you'll notice is that the scientists are going to say, stay in, don't go out. And business leaders are going to say, we got to get things going. Opposing interests. What I think you will see is that there will be a meeting somewhere in the middle where we can do things responsibly. And there's a lot of experimentation going on right now. And we really don't know all the things that are going to stick. But much like what happened after 9/11, where we never thought we'd be taking our shoes off and going through the screening process that we do, there's going to be a lot of these measures that come into place. And it may be that there's temperature cameras when you go into public buildings or larger buildings. You may go into sports arenas and have your temperature screen, walking in, added into the metal detector. So there's going to be a lot of things that change that we're not even aware of at this point in time. The thing that I would completely agree with Karen on is that if we continue some of these best practices, such as mostly related to hygiene, we can avoid a lot of other illnesses from becoming more widespread. And I think we will just have to adapt as we move forward.
Okay. Thanks, Dr. Frank. So
Yep.
what we're hearing, what what the world's going to look like. I'm getting a lot of questions about restaurants and things like that, but what I'm hearing from my medical experts is when we go back to work, the question is when. There's definitely going to be social distancing in our future until we get a vaccine, right?
Yes.
So
Yes.
until we get a vaccine, social distancing is going to be a part of our life. We're going to have to stay at home. If you have the sniffles, if you, like we say at City Hall right now with the essential workers in City Hall, if you cough more than once an hour or sneeze more than once an hour, people are looking at you funny. Like, we can't tolerate that kind of stuff. You can't get other people sick. That's going to be part of our future. Wearing masks in public is going to be part of our future. Washing hands, hand sanitizer, part of our future. Fever checks to get into buildings. We're ordering accurate thermometers right now so that, and we have them actually from the Hammond Fire Department. When you want to come into our buildings, like Dr. Frank and Karen both said, temperature check as soon as you walk in. If you're carrying a fever, you cannot come back until you're back down below 99. That's going to be part of our future. Handshakes until further notice. I mean, that's something we all I grew up shaking hands. I mean, it's gone, obviously. And then Dr. Frank even talked about some things about national policies in regards to manufacturing. The fact that we have to call China and beg for PPE is unacceptable. So the world's going to look a lot different when we come out of this. The question is, when do we come out of it? A lot of questions about, are masks required by the city of Hammond, by the state of Indiana? Kevin Smith, where are you? Is he listening? Could you unmute him? Kevin, can you hear me?
Yes, I can hear you.
Can you give us an update on, first off, I was asked a question, are masks required by the city of Hammond? And I don't believe we covered that issue with our executive orders, correct?
That's correct, Mayor. You did not cover masks as a mandate as part of your executive order.
How about in regards to the state of Indiana? Has Governor Holcomb mandated that, or is it just a CDC recommendation?
It's only been a recommendation. I think the governor has echoed that and said that we should all be responsible if we feel that we're going into a public place, especially like, for example, I know you do this, Mayor, I do too, in a grocery store or in Menards. I've worn a mask every time I've gone in, and I just consider it kind of a personal responsibility thing, but I think it's only been recommended, not mandated.
Okay. Is there anything else you need to tell from the corporate council's perspective in regards to where we are? Anything you want to remind? A lot of people watching this, Kevin, haven't heard. We've been through 20 of these meetings or 10 of these meetings. Is there anything you want to remind people, the residents of Hammond in particular, about where we stand right now?
Well, Mayor, I just want to reiterate that I think what you're doing is essential, making sure that people are updated. I think that's important. From a legal perspective, I would just indicate that your executive orders and the governor's executive orders are what we're trying to use as our guide as we move forward. And I know you've been very conscious of making sure to keep up with the governor. And you've also made some decisions on your own for both employees and for the residents of the city of Hammond to try to keep them safe. So what we do is just to continue to monitor and take your direction and try to help and make sure we're following what the law is.
Thank you, Kevin. Okay, I'm going to close with reminding people that are watching, the state of Indiana right now has 15,000 Hoosiers positive for the coronavirus. 18% of the people that take a coronavirus test turn out positive, and about 1 out of every 100 people that take the test unfortunately pass away. That's the rate right now. Hammond in particular has 235 positive cases. We tracked this number starting Friday, and it's gone up 14 since Friday. We've had 1 person pass away extra. We had 10 total fatalities due to COVID-19 in Hammond, and 235 positive cases as of yesterday. Keep that in mind when you're going out in public and you're not wearing your mask, or you're going out in public and acting like things haven't changed. Right here in Hammond, we have 235 cases. In Lake County, we have well over 1,000. So this is happening right in your backyard. Anybody else have anything they want to add before we go ahead and close up this meeting. I want to thank our interpreter very much. I'm sure she's been very tired trying to keep up. Thank you very much. We're going to make sure that she's on every meeting from here on out. And I think this is the right format going forward for us to handle our coronavirus task force meetings. Instead of making them a administration meeting, I'd rather do it this way so that we talk to each other and the members of the public at the same time. We had an audience of close to 250 people the entire task force meeting. So I want to thank everybody who participates in our task force. And I want to thank everybody who's watching in the public and remind them we do this every Monday and Thursday at 10:30 in the morning. So I'm going to adjourn the coronavirus task force meeting until Thursday, 10:30, when we update you again. Thank you, everybody. Take care.